because health sometimes feels like outside of our control. No one asks to have diabetes. No one asks to be allergic to bees. And yet it can greatly impact how we interact with and enjoy our environment. So it is a really interesting question, because coronavirus, COVID-19, I think poses a challenge for everyone all at once in mass. We can't get, our flu shot to say, well, I at least can, protect myself. There's no option there. We can't tell, oh, well, you have a runny nose, I can stay away from you. Well, maybe they're asymptomatic. There's no way to really track what's going on. And like you mentioned before, Catherine, symptoms change all the time. And so here now, as we have evolved as a society, we are wanting to make sure people can feel safe and comfortable and predict that level of safety with a virus that no one knows about. And so in this instance, I think that's where we are asking the government to say, you've got the best information here, better than we have. And if possible, please help us understand what the risks are, what we can do. And that's why I think Utah especially almost, immediately kind of shut everything down to figure out, what is this? What's going on? How is this impacting everybody? Because like I've seen some describe, it's kind of like, glitter. If you've got glitter everywhere, you don't know yet who has the glitter. So y'all go home, figure out who has glitter before it's spreading that glitter everywhere. And so that was, I think, Utah's response. And since then, as we've gotten back to trying to open up that economy and get back to somewhat normal, there's another question like, well, do we, how do we keep people safe now? Do we keep shutting things down when the numbers are going up? How do we make sure, like, kids going back to school, how can we make sure they're safe? Because children and families should be able to predict somewhat how to deal with these things. And it's a huge question mark that we're all grappling with, and we all immediately turn to the government. Will tell us what to do, right?
And then there are those that say the government shouldn't tell me what to do. And that's, I think, where we're having a hard time with that. I'll just say, when we were first facing quarantine, my family sat down and we watched the new Planet of the Apes movie, just because we needed to laugh at something. But I was thinking of this, like the virus that annihilated the planet. Did the government have a role in that? Where does the government's responsibility begin in saying, you need to make sure that you do this? Granted, this is not like the simian flu in Planet of the Apes, because fortunately so many people do recover from this. However, we don't know what the long-term effects are going to be just yet, because we haven't had enough time to realize what those long-term effects are. But we vote for people in government to kind of govern us, to tell us, to help us, to listen to us, and to come up with solutions that help affect the most people possible. And I think that's why we're having this kind of conversation right now. And I think we need to continue having these conversations as we listen to each other, validate the feelings of fear and insecurity, say, yeah, that's completely understandable. Let's sit with this feeling for a little while, and then let's act. Let's do something. How can we make you feel safe and help other people around you feel safe, and keep it's something I think we're going to have to sit with for a while as we try to figure this out. I don't know what even the question was. Was that kind of even related?
Yes, that was great. This is a very complex question.
It really is.
Yes. I also have been thinking about public health, and in many ways, public health departments operate in very invisible ways. Like when you have sexually transmitted infections in the community, like they monitor who is diagnosed with these communicable diseases that can have really serious complications for many people. But however, many people do spread them without knowing that they have no symptoms. Another instance would be hepatitis A, which is spread from fecal matter and then on food. And if you've donated blood, recently occasionally there's like an outbreak in your area and it says, did you eat at this location between these days? Because hepatitis A can be benign for many people. It can be sort of like flu-like, but it can also cause significant liver damage. And again, like it's another disease that is spread in the community through like, unsanitary conditions. And however, those aren't super widespread infections. So most of us are not interacting with the health department in these ways. And so we're not really, it hasn't impacted us in the same way at all as something as widespread as this respiratory infection, which is, which is spread pretty easily. It's not simply like, oh, well, I don't eat a hot dog at 7-Eleven and so I'm fine. But whatever. I only have a couple of sex partners or one sex partner or none or whatever. But so this is a really for many of us, it's the first time we've ever thought about public health and communicable diseases in this way.
Sure.
So also really, really complicated. I think I read a couple of days ago that Goldman Sachs had done an analysis of economic impact of reducing the spread of the virus, and if we could control the disease by wearing face coverings, then we could save $1 trillion of economic activity in the United States. Because not only when you think about sick people and even a rise in case numbers, it has a chilling effect on our own behavior and on our spending. And like maybe I decide, oh no, it's just not safe for me to go to a restaurant. Therefore I'm not, or tourism. It's not safe to go to stay in a hotel anywhere, to take a road trip or whatever. So even if we're not sick, or if there's no government mandate to close the economy, the disease itself has an impact on people's behavior if you're not sick. And again, if you are sick, then there's all of that lost work time. And in close quarters, like meatpacking plants, there's been widespread infections where you've had a lot of people who become ill. And so like the balance of illness, economy is so multifaceted that it's unprecedented, I think, for us to grasp all of the impacts that are interacting here.
Did you have other questions, Catherine? That was one that you asked.
Yeah, we had another one. Will we see a statewide mask mandate now that the primary election is over?
I'm not going to lie. That thought has crossed my mind a time or two. It's sad that this has become so politicized. It's become such a weapon.
I think it's very telling that now that the primary election is over, now you notice we only had one primary in our state, and that's the Republican primary. And so basically everything is led by the Republican primary and that platform, and that guides everything. So I find that very interesting because kind of what we have talked about already is that this is really a community issue. It shouldn't be a political issue. It shouldn't be a party issue. And it's sad that politics and elections end up guiding our behavior. But the question about whether it's going to become mandated, I think it goes back to location, because not all communities are faced with the same risk level. Not all communities should have to have the same rules imposed upon them. And I really do like that idea that case by case, community by community, they can decide what they feel comfortable doing. And if they want to have that because there's a more concentration of people, or if they say we don't need that because we're spread out well enough. And if individual companies or, grocery stores are doing things to kind of help that, and individuals are making decisions, communities might not see the need to mandate a mask. And so personally, I still don't think that the state would require masks on a whole state level. They might just keep encouraging people, which they already have. They've encouraged people to wear masks when they can't be more than 6 feet, when they can't be 6 feet or more apart. And so they will probably continue that guidance, but I think that not every community is the same.
I think that's a great point. I agree that probably the more rural counties will not have a great need for masking at this point. I think that it will be like a county by county, or even cities will be involved in maybe making a specific determination. But because of the law, they will have to request permission to make a more strict guideline than the rest of the state. I also think that with schools, the state school board created some guidance for schools, and school districts have to make a plan by August 1st and communicate that to parents. And I think some of the guidance includes masks in passing periods in hallways. I don't think it requires masks at the current situation in classrooms.
There's no way. I teach third graders. They will not
They
keep
will
them.
not, right? But perhaps like passing period if there is a passing period, possibly. So I think that sometimes these little changes where, for instance, when more grocery stores are requiring or encouraging masks, that I have noticed a difference in behavior in Utah County in the last week, that just it seems like it tends to impact people more broadly than just a particular mandate, where they say, oh, okay, well, if I have to wear one here, then maybe I can wear one in this similar situation. I don't know. It will be interesting to see. Those were the 2 questions that we received, and those were some really, really good questions. Kate, yes, would you share the United Utah platform on healthcare and the economy, because this is really critical information.
Absolutely. All right, I'm sharing it now. Just so everybody knows, we are all united as candidates for the United Utah Party. And I just wanted to talk to everybody about the platform we have. Though when this was written, we didn't address the coronavirus. We didn't address pandemics in here. There are a couple of things we wanted to focus on. The first being fiscal responsibility. This is what we believe. We believe for economic growth, we preserve the free market system as the engine for future economic growth. This growth must raise all boats. Public policy must promote economic opportunity for all, regardless of social and economic class. And I'd like to add in here, regardless health circumstances as well. I think that's important. And then along with this conversation, think we ought to highlight healthcare. In healthcare, we would like to promote reforms that extend healthcare to more people, reduce costs, and improve outcomes and the quality of care. We would invite anyone to go ahead and check out the United Utah Party platform at unitedutah.org/platform to see what we believe in.
Great. Thank you so much. That's really helpful. And as we are all candidates, we always love to have any volunteers volunteer to help us. There are lots of opportunities that are socially distant that provide opportunities to do at home. We have needs for people to walk and hang materials from doorknobs to share pamphlets and postcards. We have a need for phone calls and other contacts to people in our districts, to voters in our districts. And also none of this can be done free of charge. So printing materials has costs, making signs has costs. So even small donations are always welcome. And powered by the people, we're not given large quantities of money by political action committees or corporate donors. So we're reliant on small donations. So we all have donate buttons on our websites. And We welcome more comments, more questions anytime. And it's been great to have this discussion. And I love talking to all the two of you and having discussions where we don't always agree, but we can share perspectives and understand each other and be more enlightened and learn and consider new things. So thanks so much for joining us.